Asthma is a prevalent chronic respiratory disease affecting millions worldwide. This video provides an overview of asthma, including its pathophysiology, diagnosis, and treatment. Asthma is characterized by airway obstruction due to inflammation and bronchial hyperresponsiveness. Effective management involves accurate diagnosis, trigger control, and individualized treatment plans. Asthma is defined as a chronic inflammatory disorder of the airways characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. The hallmark of asthma is airway hyperresponsiveness, meaning the airways overreact to various stimuli, leading to narrowing and airflow limitation. The inflammation associated with asthma involves a complex interplay of inflammatory cells, mediators, and structural cells within the airways. This chronic inflammation contributes to airway hyperresponsiveness, making the airways more susceptible to constriction in response to triggers. The reversible airflow obstruction in asthma is a key feature that distinguishes it from other chronic obstructive pulmonary diseases. This reversibility means that the narrowing of the airways can be improved with appropriate treatment, such as bronchodilators, which relax the smooth muscles surrounding the airways. Asthma symptoms typically manifest as episodes of wheezing, shortness of breath, chest tightness, and coughing. These symptoms can vary in severity and frequency, ranging from mild and intermittent to severe and persistent, significantly impacting an individual's quality of life. The pathophysiology of asthma is complex and involves a multifaceted interplay of genetic predisposition, environmental factors, and immune dysregulation. At its core, asthma is characterized by chronic airway inflammation leading to airway hyperresponsiveness and reversible airflow obstruction. The inflammatory cascade in asthma is initiated by the activation of inflammatory cells, primarily mast cells, eosinophils, and T helper type 2, Th2 cells. Upon exposure to triggers such as allergens, pollutants, or viruses, these cells release a cascade of inflammatory mediators. These inflammatory mediators, including histamine, leukotrienes, and cytokines, exert potent effects on the airways, leading to bronchoconstriction, increased mucus production, and vascular permeability. Bronchoconstriction refers to the narrowing of the airways due to the contraction of smooth muscles surrounding the bronchi. Furthermore, chronic inflammation in asthma contributes to airway remodeling, a process characterized by structural changes in the airways. Airway remodeling involves thickening of the basement membrane, increased mucus gland size, and smooth muscle hypertrophy, further exacerbating airway narrowing and airflow limitation. Recognizing the signs and symptoms of asthma is crucial for early diagnosis and treatment. Hallmark symptoms include wheezing, shortness of breath, chest tightness, and coughing. Symptoms can vary widely, and not everyone will experience all of them. Recognizing these symptoms early is essential for managing asthma effectively. Identifying asthma triggers. Identifying and avoiding asthma triggers are crucial aspects of asthma management. Triggers are substances or conditions that can irritate the airways and provoke an asthma attack. Common asthma triggers include allergens, irritants, respiratory infections, exercise, weather changes, and emotional stress. Allergens are substances that trigger an immune response in susceptible individuals, leading to airway inflammation and bronchospasm. Common allergens include dust mites, pet dander, pollen, mold spores, and cockroaches. Irritants, unlike allergens, directly irritate the airways, causing inflammation and bronchospasm. Respiratory infections, particularly viral infections such as the common cold or influenza, are common triggers of asthma exacerbations. These infections can inflame the airways, making them more sensitive to other triggers and increasing the risk of an asthma attack. Exercise-induced asthma is a type of asthma triggered by strenuous physical activity. It occurs due to the increased ventilation during exercise, which can cool and dry out the airways, leading to bronchospasm. Weather changes such as cold air, dry air, or sudden changes in temperature can also trigger asthma symptoms in some individuals. Diagnosis and assessment of asthma. Diagnosing asthma involves a comprehensive evaluation of the patient's medical history, physical examination, and pulmonary function tests. A detailed medical history is crucial in identifying characteristic symptoms, potential triggers, and any family history of asthma or allergic conditions. Pulmonary function tests, or PFTs, are objective measurements of lung function that are essential for diagnosing and monitoring asthma. Spirometry, the most common PFT, measures the volume and flow of air that can be inhaled and exhaled. In asthma, spirometry typically reveals reduced airflow, particularly during exhalation, indicating airway obstruction. Another important PFT is bronchodilator responsiveness, which assesses the reversibility of airflow obstruction after the administration of a bronchodilator medication. A significant improvement in airflow after bronchodilator administration supports the diagnosis of asthma. Peak flow monitoring is a valuable tool for self-monitoring asthma control. A peak flow meter is a handheld device that measures peak expiratory flow, or PEF, the maximum speed of exhalation. Patients can track their PEF readings over time and identify any downward trends indicating worsening asthma control. Comprehensive treatment options for asthma. The primary goals are to control symptoms, prevent attacks, and maintain lung function. Treatment involves medication and non-pharmacological strategies. Medications include quick relief and long-term control options. Quick relief medications provide rapid symptom relief. SABAs relax airway muscles and improve airflow. Inhaled corticosteroids reduce inflammation and prevent attacks. LABAs relax airway muscles for extended periods. LABAs should be used with inhaled corticosteroids. Leukotriene modifiers block inflammatory mediators. Long-term management of asthma. Long-term asthma management requires a multifaceted approach that extends beyond medication and involves patient education, self-management strategies, and regular follow-up with healthcare providers. Patient education is essential for empowering individuals with asthma to take an active role in managing their condition. Patients should be educated about asthma triggers, early warning signs of exacerbations, proper inhaler technique, and the importance of medication adherence. Self-management strategies such as peak flow monitoring and asthma action plans are crucial for patients to monitor their asthma control and make adjustments to their treatment plan as needed. Regular follow-up with healthcare providers is essential for monitoring asthma control, adjusting treatment as needed, and addressing any concerns or questions the patient may have. Follow-up visits should include a review of symptoms, medication use, peak flow readings, and any exacerbations or emergency department visits. Asthma action plans are individualized written plans developed collaboratively by the patient and healthcare provider. These plans provide clear instructions on how to manage asthma daily, recognize worsening symptoms, and take appropriate action based on peak flow readings or symptom severity. Finally, in conclusion, asthma is a chronic respiratory disease characterized by airway inflammation, hyperresponsiveness, and reversible airflow obstruction. Understanding the pathophysiology, recognizing the signs and symptoms, and identifying triggers are crucial for effective asthma management. Diagnosis involves a thorough medical history, physical examination, and pulmonary function testing. Treatment typically involves a combination of quick relief medications for immediate symptom relief and long-term control medications to reduce inflammation and prevent exacerbations. Patient education, self-management strategies, and regular follow-up with healthcare providers are essential for optimizing long-term asthma control and improving quality of life. Early diagnosis, appropriate treatment, and proactive management can significantly reduce the burdens of asthma and allow individuals to live full and active lives. Continued research and advancements in asthma care hold promise for even more effective treatments and improved outcomes for individuals with this prevalent respiratory condition. Thank you for watching and don't forget to subscribe. See you next time.